A controversial police reform bill was approved by the Massachusetts Senate earlier this week. Critics have called the proposed bill, written in the wake of protests calling for racial equality and an end to brute force used by some police officers, rushed, among other things. State Senator Eric Lesser, a Longmeadow Democrat, told us the bill is a move in the right direction. But first we talked about COVID-19. Now through August 14th, the Baker administration has set up free COVID-19 testing sites in 8 communities. The tests are available to any state resident, but none of the new sites are in Western Massachusetts.
Well, frankly, Carrie, I first learned about it from a press conference. The governor did a press conference announcing the Stop the Spread initiative, and I just want to say I absolutely support the effort to set up no questions asked, free testing, walk-up testing, especially in our most vulnerable and hard-hit communities. The initiative that the governor announced was setting up 8 testing locations in 8 communities that have been disproportionately hit by the COVID epidemic. But I was shocked when actually looking at the list of 8 communities to see that not a single one was west of 495 or the 128 interchange. The only one even remotely close to Western Mass was in Marlborough, which is 70 miles from Springfield. It is just simply unacceptable, Carrie, that somebody in Springfield, somebody in Chicopee, somebody in Holyoke would have to drive 70 miles to get an access to this program. Somebody from Pittsfield would have to drive over 100 miles, not to mention our rural communities, our hilltown communities that have also been disproportionately hit by this epidemic that would simply have no access under this program.
And when the governor said, when he spoke about how they decided on where they're going, he did say, they were focusing on these hard-hit communities. And specific to Western Massachusetts, while we did see the epidemic essentially start here in the Berkshires, the governor said that since then we've seen cases go down and stay low. So that was his justification for that. It seemed like he did at least think about Western Massachusetts. Have you had any back and forth with the governor's office since then about maybe adding additional sites or whether he'll change his mind?
Well, we made very public our dissatisfaction with that explanation. We have not heard an explanation since then from him. But what I would say is, that explanation just is not acceptable. Quite frankly, it seems to erase what we've learned about coronavirus in the 3, 4, now 5 months this has been dominating our lives. The explanation that we're only going to put testing in once we see surges is like saying we're going to ignore a smoke alarm and we're only going to send a fire truck when there's a 4-alarm fire. It simply doesn't make any sense. We know that the testing often lags the actual prevalence of cases in a community. We know that a very small number of the total cases in a community actually results in positive tests. We also know that it can take weeks after those positive tests come in to actually see hospitalization rates go up, to see death rates go up, and to get the spread under control, because we also now know that only one, for example, positive individual could potentially spread the disease to dozens of others. So the idea that we would just wait until we saw the spike emerge, it would be too late if we waited for the testing for the spike to emerge. And I would point out, Carrie, that a lot of the risk factors that have been identified by the governor, that have been identified over the last several months, an older or an aging population, for example, populations that are experiencing, housing insecurity, people who are in substandard or in crowded housing, immigrant communities, communities of color where there are high numbers of essential workers. We know at this point, after months and after data both from the state and nationwide, that those groups are at higher risk factor for infection and for prevalence and for spread. We have those communities in disproportionately in Western Mass too. So the idea that you wouldn't proactively put the testing here is shocking. And again, it just feels like months of work and knowledge that have been gained about this virus are being erased. And frankly, what's happening right now in Florida, in Texas, in California, and Arizona should be a wake-up call, because they were complacent there about doing the proactive testing until, unfortunately, it can be too late. Because again, we know once you start seeing the spikes in the testing, there are potentially thousands more people that have already been infected.
Something that we've known or seen throughout much of this pandemic is a supply chain issue when it comes to testing. We're still hearing from healthcare officials that supply chain is an issue. How do you think that this should be addressed?
It's a very big concern. It's especially a concern now that you see huge states, with massive populations, Florida, Texas, California, with, critical shortages, and the demand is really escalating there, which will put pressure on a really global supply chain for the testing components. What we've tried to do in Massachusetts and what we need to remain focused on is bringing those supply lines closer to our community. So, for example, Universal Plastics in Holyoke makes components for the diagnostic tests that test for COVID-19. We need to support those efforts. We need to bring more manufacturing closer to home here in Massachusetts, and we need to be purchasing those products from manufacturers here in Massachusetts. Frankly, it creates jobs in our community and it creates economic investment in our community, which is very important. But frankly, it also is just easier. And it gives us better control over the supply lines and more confidence that we're going to have the testing that we need. I'd also point out you have a lot happening right now in terms of schools potentially preparing to reopen, big employers, big institutions reopening now. The economy is starting to reopen. Of course, when that's done safely, that's important, but that's going to put a lot more pressure on the testing supplies. We need Massachusetts to be focused on, as we just mentioned, number one, bringing those supply lines closer, bringing that manufacturing closer. But number two, we need to be stockpiling and we need to be warehousing and creating a backup of these products while the cases, knock on wood, are relatively low in Massachusetts.
Would you be in favor of some type of a requirement, state requirement, that people need to be tested before they head back to school, before they head back to work en masse?
I think it's very important that we move towards some type of universal testing model. Frankly, at this point, we know that until there's a vaccine, until there are proven therapeutics, we have two real tools for controlling the virus. Number one, it's the social distancing, the 6 feet separation, and the masks, avoiding crowded indoor spaces as much as possible. And number two, it's quickly isolating the positive cases that do happen and quickly supporting those individuals so they can quarantine safely and that their close contacts can quarantine. And the only way you can do that, the only way you can act on that strategy is with rapid and very widespread testing. So, a requirement, I don't know if it necessarily needs to be a requirement. My guess is most people are going to want to be tested before they kind of engage in a lot of active congregating. But absolutely, everybody who wants a test needs a test and should be able to get a test. And the turnaround at this stage, months and months in, needs to be much faster. And I would support, for example, reopening schools, doing surveillance testing. So we have school nurses at every school in Massachusetts. The school nurses with proper supports in place could be doing testing at the school all day long, keeping track and keeping the population in that school safe. If there's a positive case, that person can immediately be given support, be given the ability to quarantine, and the close contacts and people who came in contact with that person could also similarly be quarantined and supported during that quarantine. So that means paid sick leave and other supports. This is the only tool we really have right now, and the economies of the countries that have done this effectively, New Zealand, Germany, Taiwan, have been able to largely reopen in many respects their economies as long as they stay vigilant about the testing and the contact tracing.
We're short on time, so I want to move us on to talk about the police reform bill, which on Monday night was a late night for the Senate. It was 4 a.m. or so that you all wrapped up. I want to read something from State House News. Quote, senators referenced difficult, gut-wrenching conversations that occurred behind the scenes. It was clear that lawmakers were trying to act to curb blatant police misconduct while also weighing allegiances to the police and the important work that they do. Did you agree? Did you have gut-wrenching conversations about this?
Well, they were very important, very difficult conversations. I take every vote and every issue that comes before me in the Senate very seriously. I'm not sure I would necessarily use that language. Look, we need reform. Reform is urgent. There need to be changes. And frankly, it's important for law enforcement as well to repair and rebuild and create trust in the communities that they serve. That ultimately certainly is very important for the communities, but is also very important for the police. So these are hard debates. We, of course, respect and honor law enforcement and the men and women who really, in a very selfless way, serve their communities day in, day out. But we have to acknowledge that there needs to be reform, that there have been serious abuses. And frankly, Carrie, those abuses have not been isolated to Minneapolis or to other states that we might watch on TV. We've had those abuses in Massachusetts. And the DOJ report that came out about Springfield recently is an example of that. And I think the way we respond to that is by being proactive, by lifting up the strategies that we know work: community policing, reinvestment, investment and focus on social services and support, and where appropriate and where it is necessary, doing reforms that are hard and making sure that there's accountability. So, I think the takeaway for people should really be that these are generational challenges, centuries long challenges with systemic racism and its role in police work. It's not going to be fixed in a day. It's not going to be fixed in a vote. But in our time, in our place, in this moment, we can make very important and very meaningful and, frankly, historic strides towards more equality. And that's what happened last night and into the early hours of the morning.